Welcome to another question and answer session run by Somerset County Council alongside our colleagues and partners from the NHS. Tonight we learned that Somerset will remain in Tier 2 with our neighbours in North Somerset and Bristol moving down a tier to join us. The key difference though, as we'll hear in just a moment, is that North Somerset and Bristol cases are falling and quite rapidly. Sadly, that's not the case here in Somerset, where cases are rising and quite rapidly. Somerset County Council's Director of Public Health, Trudy Grant, will give us the latest update in just a few moments. This question and answer session will be hosted by the Council Leader, David Fothergill, and there are a number of experts and specialists to help with any specific questions that you might have. We're also fortunate to have Alison Wootton on the call. Alison has a new role, which is to oversee the Somerset vaccination programme. Not a small task, but a huge responsibility. So we're really grateful to have her on the call tonight. A few house rules for the next hour or so. After some short presentations, we'll take all the questions that come in. If you want to make a point or ask a question, move your cursor onto the screen. On the right-hand side, you'll see two question marks in a rather strange speech bubble, and you can click on that and write in that area. Please, if you can, write your name on top. This will help us give you a very specific question or response. And if it's something that we can't answer, we'll take it away and then get back to you when we find out. We'll put any relevant links into the chat function of this session, so keep your eyes peeled for that. But I hope you have a pleasant evening. Do ask all the questions and make all the points you want to. We will get round to everything that we possibly can. And with that, I'll hand on to the Council Leader, Councillor David Fothergill. David.
Thank you, Simon. Thank you, Simon, and a warm welcome to everyone that's joined us tonight. We held one of these webinars about 3 weeks ago. I'm sure many of you were with us as well, when we had something over 100 people on the line. So not sure at the moment, but we felt that it was really worthwhile doing and that we should repeat it again. Clearly, things have changed dramatically in the last 2 or 3 weeks. We went through a period of seeing a fall in our numbers, and then about 10 days ago, a plateauing out, and sadly, over the course of the last week, we've seen an increase, and quite a dramatic increase in the last few days in terms of our numbers across the county. I think that led many of us to believe that we were probably heading for Tier 3. That would not have been a surprise to myself and many other people, but ultimately the government decided that we'd remain in Tier 2. I think we have some challenges, particularly as we go through Christmas and the new year, and we really do need to be doing the right things. Otherwise, I think Tier 3 will come towards us much quicker than we're expecting. Our neighbours up in North Somerset and Bristol, of course, have just been moved down, and they're now in Tier 2. That will create some challenges for us as people travel across the border from North Somerset into Somerset. Devon and Dorset remain in Tier 2 as well, alongside us. So down in the southwest, apart from Cornwall and the Isles of Scilly, of course, we are pretty much now all Tier 2 related. So this is your opportunity to ask some experts some questions as they relate to you and your families and the county and anything else that you want to ask. In particular, we're going to be looking at the tiering system, which I'm sure you're beginning to understand anyway. We're going to look at Christmas, and one of the interesting things that I picked up the other day was actually the tier system remains, and the Christmas regulations overlay that, so we will still be in a tier throughout Christmas. We just need to be aware of what the difference is for the Christmas regulations. And thirdly, of course, there's the vaccination programme, which is now started to roll out, and that is really, really exciting. And I think as Christmas comes, New Year, we'll begin to see that gather pace. So you'll have lots of questions for Alison, I'm quite sure. So the intent is to hold a conversation or to do a presentation now for you for the next 20 minutes or so, 15 to 20 minutes, and then make sure we've got 40 minutes left for lots of questions. We will be off air by 8 o'clock, so anything that you've got in the oven or waiting on the television or whatever, then you'll be there by 8 o'clock. That's our undertaking. Without further ado, I'm going to hand over to the Director of Public Health for Somerset, Trudy Grant, and Trudy's going to talk us through the current figures and a little bit more background in terms of why we've got the challenges that we have across the county. Trudy, over to you.
Evening all. It's really good to be here with you again. As David says, I'll just run through where we are with regards to the local position for our pandemic, and then we can hopefully have some questions later on. So where we are at the moment is obviously we've been in a lockdown position for the past month. During that lockdown position, we reached levels of around 135 positive cases per 100,000 population. Relatively speaking, that's not as high as some areas have seen in the country, but it was certainly the highest that we've seen in Somerset for the whole of the pandemic. We managed to get those rates down to just around 85 per 100,000. They plateaued off quite a lot during the lockdown, so earlier than we thought that they would plateau. Sadly, since the end of the lockdown, and actually just before the end of the lockdown, we have seen, as David has said, we have seen a real increase upwards very quickly. So we've seen an increase of just over 44% just in the last 7 days. So an awful lot more levels of transmission happening as society has opened back up again, and we've started to mingle more again. So in front of you should be the dashboard, which we produce on a daily basis every weekday and publish on the website, and it goes far and wide. It shows you at the moment where we have had so far 6,728 positive cases of COVID since the beginning of the pandemic. Obviously, the chances are that the figure is considerably higher than that, because that's only people that have actually been tested. So we know that there's a reasonable proportion of people that have COVID but actually don't ever have any symptoms, so they don't know that they've got it. So therefore they probably wouldn't get tested. So our latest 7-day rate per 100,000 is 123.1. So that is going up daily at the moment. I think you can see the graph on the left-hand side that actually that is the case, and we are starting to see probably about just under 100 new cases each day. Across the top, you'll also see that we are really busy at the moment. So we have 62 open outbreaks of coronavirus at the moment in our county that we're managing as best as we can possibly manage. Overall, we've had over 700 outbreaks since the beginning of the pandemic in March. So as you can imagine, it has been a very taxing time for all of us, let's face it. And the graph on the right-hand side that you can see really clearly shows the first wave that we had on at the left, which is this kind of smaller grouping of yellow, and then the larger grouping of yellow is the second wave, which we're currently in. We are seeing an uptick now. That's not necessarily a third wave. It's a continuation of the second wave. It's just that the second wave was stunted, rather, hopefully, with the lock. So, but sadly, as previous speakers have already said, we are seeing an upturn now, and it is a very worrying position. It is going up quite rapidly. Okay, if you could move on to the next slide, please. This shows you the position across each of our districts in Somerset. You can see the trend over the last 4 weeks. You can see that at the moment, all of our districts, all 4 of our districts are up over 100 per 100,000. So each of them have seen increases over this last week. It's not just 1 or 2. So the position is quite widespread throughout our county now. If you can move on to the next slide, please. Okay, and here's that showing in picture form. So as you can see, there is the reds in particular, where we've got particular hotspots at the moment. They largely relate to some of the outbreaks that I was talking about earlier. So so we do have a number of outbreaks going on in our county. the very nature of this virus is that it works very much on the basis of outbreaks and clusters. So as we manage the outbreaks and clusters in one place, they will pop up in another place. We've seen that all the way through the year. So that's the current position where as we are at the moment. If you could move on to the next one, please. Now, this is the slide which shows the magic R value, so which is the rate of transmission really of the virus. At the moment, nationally, they calculate the R value for the southwest as 0.8 to 1. There is a little bit of a time lag with the R value. They usually update them nationally on Fridays, so we are expecting an update tomorrow. We think, certainly from a Somerset perspective, our figures are going up and going up quite rapidly. So we think that we are well over the 1 at the moment. So I think that R value is probably a little bit out of date. As you can see from the graph at the bottom on the left-hand side, Somerset for the first time during this pandemic is actually over the southwest average for rate per 100,000. We're well below the national average, so that's just up over 200,000. But Somerset is above the southwest average at the moment, sadly. And the next one, please. And this slide shows, sadly, the deaths that we've seen in Somerset. So our death rate continues to grow. At the moment, we have 277 COVID-related deaths since the beginning of the pandemic. And as you would imagine, a number of those deaths happen in hospital, a number of them in care homes, and a smaller number in other settings as well. I think the important thing to point out is that whilst our deaths from COVID are increasing, there's still the death rate overall for the population is still within the 5-year range that we would normally see. I think one of the really important points to say at this point is we know that because of all the infection control measures that everybody's been putting in place, you know, the hands, face, space messages, actually those infection control measures are good for other, particularly respiratory diseases as well as COVID. So at the moment, everybody is being fantastic in getting their flu vaccination sorted this year, which is brilliant and just what we need. But also as a result, not only just of the flu vaccination, but also as a result of our infection control measures, we're not seeing quite so much circulating flu or people showing symptoms of flu coming through. And that will really help not only our NHS position and particularly primary care, but it actually will also help with our deaths, because each year we do get flu-related deaths. So that may explain some of the fact that we are still within the 5-year range of that position. The other thing I wanted to really point out, aside from the numbers, there's been lots of development going on over the last few weeks, and we'll hear about the vaccination programme, which is such good news and a really good light at the end of the tunnel, hopefully. But there is also been quite a worrying finding in that they have now found a new variant of COVID which is circulating. So viruses will often mutate, and we know that this one has mutated a little bit throughout this period of time, but not to anything significant at all. During this last week, it has come out in the news, has been announced that there has been an identification of a different strain of the virus, and this strain, whilst it won't make people more poorly, actually it is looking as though it's more infectious. And part of the reason for that is that some of the way that the virus has changed is that it's got more spikes on the outside of the virus, and having more spikes on the outside of the virus means that it attaches onto things slightly easier. It becomes more sticky, really, which makes it more infectious. So there's lots of work going on nationally. Lots of the researchers are looking at this new virus. At the moment, they don't believe that it will make any difference. It will still, the vaccine will still be relevant to this virus. They just know that there are certain changes that have happened to the virus, but at the moment they don't think that the vaccine will be a problem. It will still be effective with this virus. But because it's more infectious, it actually means that we do need to make sure, even more so, that we are really, really careful, and we must make sure that we stick to the good infection control. So if it is more of an infectious virus, actually the need for us to keep those big messages about hands, face, space are even more important than ever before. But actually, I would also urge everybody to start thinking just a little bit smaller than just the big high-level messages. Start thinking about how the virus might be transmitted and how you might change even little things in the way that you live your life to be able to then stay a little bit safer. So I want to give you a couple of examples. So one example is when we've been looking at some outbreaks across the whole southwest. One example we found is that there was quite a large outbreak actually in a GP surgery. And the only thing that was common, the only thing that they think that made that that virus spread throughout the staff in that GP surgery was that the staff at the surgery were making cups of tea for each other, and they were catching the virus off of the handles of the cups. So that just goes to show just how small actually you need to think. So we just need to keep these kinds of things in our minds all the time. Make sure you keep washing your hands really thoroughly on a regular basis and try not to touch your face. And they're really key messages. Just one more, just David, I'm sorry to go on, but I just want one more because the other one I think is really important is one thing that we've also been looking at is vending machines. And vending machines, was really convenient for most of us, actually have potential to spread the transmission of the virus. So if you think about how you work a vending machine, you take your money out of your pocket, which potentially other people will have used as well. You put the money in the machine, you press the buttons to tell them which bag of crisps you might want or which bar of chocolate you might want. And a lot of people will then take that out and immediately eat the bag of crisps with the hand that they've just picked up their coins with and pressed all the buttons with, without potentially washing their hands before they put something in their mouth. And that's the kind of thing that we all need to be really conscious of. Just think about the detail. That's the really important point. And just before I sign off, I just wanted to touch on Christmas. So Christmas is, it's a time of year when we all like to get together, let's face it. And goodness me, this has been a really hard year. And actually all of us would like to get together with our loved ones over this period of time. At the moment, government have said very clearly that we are able to mix with 2 other households during this time. Only 2 other households. It's not 2 households each time we mix. It's the same 2 households that we're allowed to mix with. I would urge everybody just to say, yes, we're allowed to do it, so to speak, but actually just think about whether you want to do it or not. So I think it's incumbent on all of us just to reflect on what our plans are for Christmas and make sure that we're happy that we're doing it in the way which provides the least risk to everybody. If we're seeing people who are particularly vulnerable at Christmas, just think twice about whether, firstly, it's right for you to do it, use a sensible approach, but also if you do think you're going to go ahead with it, really think about how you might reduce the risk. Really think about, are there options of meeting people outside? Are there options of using bigger households so you've got bigger rooms, you could spread out more? Can you make sure you get good ventilation in the rooms? Can you clean on a regular basis, particularly door handles and things you touch regularly, that kind of thing. So I would urge everybody just to think about what we might want to do over Christmas, and make sure that if you're going to go ahead with your Christmas plans, make sure you do it as safely as possible, please.
Thank you, Trudy. That's the second time I've heard you describe the new strain as stickier and spikier. I think it conjures up an image which we can all understand, so thank you. We're going to move on to questions, but before that, I wonder, Alison, welcome to us. I wondered if you just wanted to say anything by way of the vaccination plans at the moment, so we can just get people thinking about the sort of questions they might want to ask you. But welcome, and over to you if you would like to say a few words.
Okay, thank you very much. Thank you for having me here this evening. So my normal job is that I'm the Deputy Chief Nurse at Musgrove Park Hospital for Somerset Foundation Trust. I was given what in the organisation is called an exciting opportunity very recently, which means that they're asking you to step up and do something very, very difficult. So over the last couple of months, been working with some amazing people to try and pull together a plan for how we will offer vaccinations across Somerset. The government and the region, NHS organisations have been working on a plan in the background, and they've been supporting us to work on how we actually locally deliver this vaccine. So as you will be aware, the biotech Pfizer vaccine was authorised towards the beginning of December. Each week is going by so quickly, and we have been working on various ways that we will deliver this vaccine across Somerset. So the first site that went live is what's called a hospital hub. So this vaccine has to be stored at -80 degrees, as I'm sure you'll have heard on the freezer. There are very few of these freezers in the country. And because of the type of pharmacy that Yeovil have, meant that they could have one of these freezers in their department so that when it comes to distribution, they could distribute this drug. So they've got one of these freezers, so they became a hospital hub. It became clear when this drug became licensed that it is a little bit more fragile than perhaps people thought it was. So whereas we had hoped that we could get a lot of supply into that freezer in Yeovil and then distribute it across the county, that's not been the case. So the team at Yeovil have stepped up and they have started delivering some vaccine over there. So the government priorities, they've been reviewed. So top priority is over 80-year-olds, those in care homes and people who work in care homes. So they're the #1 priority. So Yeovil Hospital have actually been trying to find a few 80-year-olds that are perhaps passing through the building for their appointments, but also inviting care home staff in to get their vaccines. So they've run 2 weeks of programme, so they're in the middle of their second programme, so delivering a lot of vaccines over there. The next thing that started this week is delivery through people's GPs, and the GPs are linked into what are called primary care networks, so groups of GPs that cover the whole county. And I may not get this right, I think there are 13 or 14 primary care networks across Somerset. So each of those areas have got a designated hub, and we are planning to deliver vaccine through those hubs. So this week our first 4 went live, and I'm just going to look slightly to my right so I can tell you where they were. North Sedgemoor, West Mendip, and Yeovil and Tone Valley. So they will all have gone live this week and have all been vaccinating. So they will be calling in their over 80-year-olds. Not every over 80-year-old in those practices will have been called in, because that vaccine supply comes in a limited box, and until we reorder a box we have to wait. That's my dog in the background, sorry. It's real life in these things now. And then tomorrow we've got wave 2 starting to go, so Frome, West Somerset and South Somerset, with the others following on, we hope by early January. With all these areas we have to then work out, so they'll have done this once, it takes them 3 days trying to deliver a lot of vaccines every single day to use up a box of vaccine, and we're going to have to repeat that again and again and again over the coming months so that we can get the vaccine out further. Our GP colleagues are, we're hoping that they will help us, support us deliver the vaccine to the people that they would normally deliver the flu vaccine to. So starting with those over 80-year-olds and then going down, when we've got a good number of those done, down to 75-year-olds. The vaccine supply into the country, as you'll be aware, the government have bought lots of vaccine, but they can't ship it all in one go, so there is a supply, hence the sort of need to phase this delivery. We've heard that there is a plan to start splitting these bigger boxes of vaccine down to get some actually out into care homes, which was the next priority list. And we're hoping that we will start that either before Christmas or soon after Christmas. And again, that'll either be delivered by our GP colleagues or by teams of nurses, etc., that we've set up to do that. We're working on a plan to deliver to people who are housebound, because there are a lot of people that can't get out of their homes and into practices or into the centres to get them. And then across Somerset, we will be setting up, you know, either hubs or other big centres as we go down through the groups and we get more access to vaccine, where people can access their vaccine.
Thank you, Alison. That was very, very comprehensive, but I'm sure there's still going to be a few questions for you as well. So thank you. Right, I'm going to move on to questions. I recognise that we've now taken 25 minutes of the hour up, so the rest of the information I'm sure will come out in answers to the questions. The first question in is from Trish Cavell in West Monkton. With so many staff being deployed in to assist with COVID work, what sort of impact has there been on the usual delivery of services, or I suppose will there be, because there can only be more deployments as we go into the vaccination phase? I'm going to hand to Simon Clifford, who's coordinating this part of the work on behalf of the County Council. Simon.
Thank you, David. Good question, Tricia. Yes, there is bound to be an impact on services. If I just give it a little bit of a sliding scale of the size of the workforce compared to our redeployments, and hopefully that will start to give you an inkling of where the impact will come. So we're an authority of round about 3,000 staff. What we've done is we've looked at all our staff and all our services, and we sort of graded them according to the ones that would have the least impact on the public up to the ones that have got the highest impact on the public. And looking at the least and where we can possibly go to redeploy staff, we reckon there's about 700. So there's around about 700 staff that are available to be redeployed. So if I just emphasise statutory services, social care, looking after children, they will not be affected. These are the areas where we think we can take some staff and it'll have an impact, but it's a manageable impact on the public. So far, we think we've probably redeployed around about 150 people. That is within our own areas, so boosting some of the public health arenas that Trudy has described, looking at more contact tracing, looking at helping with school outbreaks. And then we are currently in the process of seeing what we can spare and who we can redeploy to support the NHS, particularly with the vaccination rollout as that comes on. Alison's described a very large project that will require a significant input from our staff in order to make it happen. Where will we go? I suspect we'll probably be in the realms of 300 or so staff at its peak when we've got this up and running properly. And we will work very hard alongside the voluntary sector, as well as our partners who are also contributing. So the district councils, the ambulance service and the fire service are already throwing their hats into the ring to help where they can. So the impact, I think, on the customer at the moment, on the residents of Somerset, is pretty limited as we speak. We've moved areas, my area looks after sort of the back office function, so we've moved people from our ICT, we've moved people from our teams that were going to be delivering transformation, we've moved some people from some of our depots. Registrars and registration services have stepped up magnificently, some staff from libraries, economy, our rights of way teams, that kind of area. So I don't think the public will notice yet. However, as we move more and more people through to support the NHS, it will become more and more obvious that some of our services will be paused, slowing down or reduced. And we will try to highlight that and make sure everything is transparent and people understand. And my plea to you through your contacts in West Monkton is just give that understanding to the people you talk with and the communities that you lead. We will do what we can, we will mitigate where we can, but there is bound to be an impact on our usual delivery of services, as you quite rightly pointed out. David.
Thank you, Simon. And you also failed to mention to Trish as well, she should go easy on her local county councillor and be understanding as well. So thank you, Trish. Right, I see there's a couple of questions coming in. We do need questions from you to be able to explore further themes. So let's take a look. I see there's a question about positive cases in nursing and LD homes, and I see that there was a question about further sessions for business shops to explain extra precautions. Trudy, I think Alison, shall we bring Alison Bell in, who is in the public health team? Alison, did you want to talk more about the business and shops and what they should be observing?
Hello, David. Good evening. So another Alison to contend with, Alison Bell, consultant in public health. So yeah, just to reassure people really that this new variant is susceptible to the same interventions. So really what we need to do is still focus on that social distancing, washing hands really thoroughly and covering our faces, and where possible ventilating indoor spaces, particularly if there's over Christmas, your social bubble. The thing about the new variant is that it will capitalise even more on those tiny breaks in, when we join our hands or when we, share a cup of tea, as Trudy said. So there's even more opportunity for it to spread. So it's more easily to spread. So we have to be extra careful with those measures. We have had a number of webinars for businesses and they were well received, and maybe the participant could advise whether they think more of those would be welcomed, because we have already done those and they were pretty well received. So maybe that's call to action to set up some more of those webinars. So thanks for the feedback.
Thanks, Alison. Actually, you prompted a follow-up question for me. I'm not sure if you want to take it or your colleague Stuart Brock would like to take it, but you mentioned there about being well ventilated. Open up the windows, open up the French doors or whatever. What is that going to achieve? Surely all it does is just blow the virus around. Stuart.
Thank you, David. Yeah, I'd like to take that question. Yes, I think this issue of ventilation is probably one that's less well understood than the hands, face and space message that we see and hear such a lot. And it's so important, especially in the winter time now when we are spending more time indoors. Essentially, if somebody has the infection, they will be breathing out virus particles all the time. If they're talking, and especially talking loudly or singing, as some people might do at Christmas, they'll emit a lot more virus particles. And of course, as Trudy mentioned before, there are a lot of asymptomatic people who have got this infection but don't know it. There's no reason why they would know it, but they could be infectious. And also people who are about to become symptomatic, what we call pre-symptomatic, will also be highly infectious for about 2 days before they get those symptoms. So somebody who is infected today in the high street, for example, may become symptomatic in 5 days' time, but for 2 days before that, they will be emitting those virus particles. Now, if you're indoors with that person, and that person is talking, is singing, is just breathing, the virus particles will be being emitted. Now, if you're in a sealed room or a very poorly ventilated space, those virus particles will build up and build up and build up, and that greatly increases your risk of infection. And that's why we say it's so important to ventilate your rooms. Ideally, have constant ventilation, have through ventilation. But if you can't do that, then at least open up the windows every so often to just get a flush of air through and clear the room and clear the air out. You have to assume that anybody that isn't in your household as a matter of routine is potentially infectious. I know that's a horrible thing to say, but that is the reality. And to protect others and protect especially the vulnerable people, perhaps your grandparents or elderly people in your household who are going to join you for a Christmas bubble, if that's what you choose to do, then ventilation is a really key aspect of this. Thank you, David.
Thank you, Stuart. And Stuart, can I just say to everybody online, Stuart's a bit of an expert on travel between tiers. So if you've got any questions about moving between the tiers he's absolutely desperate about when people cross to Wales or travel to Scotland. So any of those questions, very welcome for him. We've got a really interesting one here from someone. I'm going to throw this one to you, Trudy, in a moment. What lessons can we learn from Herefordshire to hopefully move down to Tier 1? What more can we do? Now, I've actually read an interesting press report from the Director of Public Health in Herefordshire, and she seemed less than impressed that they'd actually gone to Tier 1. So I'm going to let you comment on that, but maybe it wasn't such good news for Herefordshire.
So I think Karen White is the Director of Public Health for Herefordshire. I'm not sure that Herefordshire has been doing anything different necessarily than a whole range of us have been doing. I think the very nature of this virus, as I said earlier, is that it will increase in places and then at the same time it will decrease in other places without, to some extent, too much logic. So I think by the very nature of it, just like the Somerset map goes up and down in different places, the national map also goes up and down in different places. So I think that's one thing to say. The other thing to say, just to reassure you, is that we do have a very, very close network of directors of public health across the southwest and across the country. So we're all part of one association, the Association of Directors of Public Health. We meet at the moment probably about 3 times a week. And part of that meeting is obviously to find out how the national policy is developing and how the science is developing, how the evidence base is developing, things like that. But actually also it is also about us sharing good practice across all DPHs. So that learning is there. I'm not sure we can necessarily pull anything specific out of Herefordshire that we're not necessarily already doing. I think one of the things that's been a real plus here in Somerset, which is why we've hopefully managed to keep our figures suppressed at least to some extent, that we very, very early on in this, we started doing local contact tracing. And we've had really good results from that. So we've been linking with the national contact tracing service, but we've been enhancing that at a local level. And that's meant that not only have we been able to get hold of more people who are positive cases and support them to isolate for the duration that they've got to, but also it's meant that we've had far greater knowledge and understanding of how the virus is being transmitted in Somerset. And we've been able to use that intelligence to help us put specific communications out, to help us to manage outbreaks in particular ways and things like that. So that's been such invaluable information. So as a result, we are looking at the moment, we're developing our contact tracing services locally, as Simon said. So we've identified a number of more people to be trained in contact tracing, and they've just over the last couple of weeks they've now started to take on more of a contact tracing role. So we're now going to hopefully be contact tracing locally more of our cases, because it then means we get a richness of information about how it's going locally. So that's been really invaluable. But the learning that's going on across directors of public health and across the whole UK actually has been second to none. So it's been really good experience in that respect.
Thank you, Trudy. I'm going to move on to the question which Claire has actually posted, which is about just reassuring everybody about that testing will continue throughout the festive break. So I'm going to hand over to Alison on that one in a moment. But first of all, I'm just giving Alison as well from Vaccination there. Sorry, Alison, I've forgotten your surname for a moment. So I'm going to come back to you in a moment when our Alison Bell has spoken and say vaccinations over Christmas. Is that going to continue as well? And, you know, what should we be expecting to see and hear? But first of all, Alison 1 and then Alison 2.
OK, so we're going alphabetically. Lovely. So in terms of testing over Christmas, yeah, really important. If you get symptoms, you need to self-isolate. Doesn't matter if it's Christmas Day, you need to self-isolate, and your household does, and your bubble, if you're in one, on Christmas Day. The testing centres will be open, reduced hours, but you can still access it through the national portal And we're quite fortunate in Somerset at the moment because we have mobile testing in Yeovilton on the A303 and Frome at the Cricket Club. And then we've got a walk-in centre at Bridgewater Town Hall and the Regional Testing Centre at Taunton. And just for Christmas, we've got a centre opening up in Street at the Victoria Club. That's just opening on the 22nd, 23rd and 24th, and then it will be reopened after Christmas. So people can access testing over Christmas.
Thank you, Alison. I'm going to Alison Wootton now. So Alison, if you could say just a few words about whether we're continuing to vaccinate over the Christmas period as well.
Yeah, so as I described, those GPs coming online, so there's vaccines going out Friday, Saturday this week, and then more early next week. And then vaccination starts again on the 28th in a further area. The message that I'm supposed to get across is don't call us, we will call you. So your practices are working through those lists and they will call people when they've got vaccine appointments and slots available. So it will take some time. Some people, you know, will have to wait a bit before they get them, but they are working through those lists.
Thank you, Alison. Just continuing the Christmas theme, and I guess this is going to be one back for Trudy, so just putting you on notice this is coming your way. So people that do have two different family groups with them, so there's three family groups, and they pop down the pub for something to eat. Can you just explain, because my understanding is that the tier regulation still exists, the tier 2. So even though you are as a group in your own house, if you go down to the pub, you can't actually sit together in the pub. I think that's right, isn't it?
Yeah, so that's right. So the tiers do remain, absolutely, David. And so it's really just that household part of the regulations that changed during the Christmas period. It's not the whole thing. So yes, that is absolutely right. And the whole I know it might sound a little bit odd to people, but the whole premise is just about trying to reduce the numbers of social contacts that we have over that period of time, recognizing that we will all want to have just a little bit more so as we can see friends and family, but actually we still do need to make sure that we keep that quite close and we don't necessarily just go and live our lives as we normally would have done potentially. So it's just to be able to restrict it a little bit more, but give people a little bit of a leeway to be able to see their friends and family.
Thank you. Yes, and I think that there's a little bit of misunderstanding out there with people about the fact that the tiers continue through the Christmas period. The same tier restrictions exist with retail units and with restaurants and with pubs. They still exist, but there is an overlay for households meeting in homes. I've got a question coming in about just to give you some reassurance on the vaccines. Alison Wootton, this one's going to come to you. It is just, can you give everybody some little reassurance, please, about the vaccines, that they've gone through all the necessary rigorous testing, and just if you could just let people know that are hungry for information where they would go to actually find out what the testing is that they've gone through and how they've been approved. Thank you, Alison.
Yeah, so I can do some of that. So normally vaccines do take years in the testing process, but actually internationally, every piece of research material has been pumped into this process. So rather than one process following another and one company just researching one vaccine, everybody is joined together to deliver this. You know, I can reassure you that every test that would be undertaken for anything to come to the market has happened. So, you know, I've read some of the information myself, and you know, and I've actually been lucky enough to receive the vaccine because I was vaccinating on Saturday last week. So there's information on the government websites, on the .gov.uk websites. If anybody wants to read the information, when you are getting your vaccine, you will be given some leaflets to read. You know, you will need to make sure you understand the nature of it and what you're being given. But you know, I've had it myself. I would recommend that everybody that gets the opportunity to have it, it is the way that we hopefully will be able to move forward.
Thank you, Alison. And I'm just going to turn back to Alison Bell from a public health point of view. Alison, is there anything you wanted to add about the safety of the vaccine?
No, I mean, we've heard it firsthand from the Deputy Chief Medical Officer, who is a virologist actually, that he would recommend it to his mum. I think that's probably one of the best endorsements you can have, that someone is not as lucky as Alison Wootton to have yet had it because they're not vaccinating. But I think, you know, we have the Joint Committee of Vaccines and Immunisations that's internationally recognised, and they scrutinise all of our vaccine recommendations, and they're not going to take a risk with our public's health. You know, the world is looking at us, and seeing those pictures, I was sat in A&E actually with my daughter, seeing those pictures beamed around the world of us being the first country in the world to vaccinate some of our most vulnerable residents made me certainly very proud to work in public health.
Good. Thank you. I'm just going to pass back to Alison Wootton now, who I think just wants to add something to that as well.
Yeah, so a couple of things. We can't underestimate the impact of this vaccine. I've heard over the last few weeks from a lot of professionals and a lot of people that are working in care what it means to get this vaccine. You know, on Saturday we had care home managers and care home workers essentially in tears because they could see that life might get back to normal for them. You know, I had a GP this week who, you know, after, you know, several weeks of intense pressure for her and her team, delivered their first clinic, and she described that as the best day of her career ever. You know, so we cannot underestimate the impact of this. And and actually, while I'm online, I want to thank the council, because actually this has not been just an NHS effort. We have really had to pull out all the stops, and we've got members of the council sort of helping us left, right and centre. I didn't know about gritting before, I do now, but I know a man I can phone when I need it. You know, everybody has been absolutely fantastic, but that's the only way we will get this done, because it is a huge task and we're all going to have to work together.
Thank you, Alison. Those are very kind words. I think this is a serious question, but let's take it anyway. Is it worth reminding people with the Met Office weather alert about wet face masks? I'm not sure I know anything about wet face masks. I presume there's a serious side to that question. Is that Trudy or perhaps even Stuart?
They're not effective if they're wet.
Alison Bell, please. Thank you, Alison.
Yeah, face masks don't work very well if they get wet, so you need to take them off if they are wet and put a dry one on. So I'd recommend taking an umbrella. If you look at the Met Office app and it says that it's going to rain, take an umbrella and a spare mask maybe.
Thank you, Alison. Right, when and where will the big testing centres we were promised be, and when will they be starting up? The Bath and West Showground was named in a number of papers last week, saying that they were ready to go. So I think, Alison, this one's coming to you again as well, I'm afraid. But when do we think we'll get the big testing centres, the big vaccination centres set up? I think that's the question.
So it's not been confirmed, although obviously we are working on where those sites are and we're working on setting them up. There will be announcements at the right time from the government, so I'm not allowed to announce where they are, but there will be some local people who have very much clicked where they are. So we're working on setting those centres up. What we don't have is a go live state. We are getting them ready. We're working on a model so that we can staff them. We're getting all the equipment in and ready to go. So when there is a good enough supply of vaccine and we've done enough of the sort of over 80-year-olds in care homes and we can open that up to a wider audience, the information will be published then.
Thank you. I guess the AstraZeneca vaccine will be a bit of a game changer all round because it'll be much more simpler to deliver.
Yeah, that's a thought. We have got a big supply of Pfizer that we've bought, so no doubt we will be using it somewhere, but there are centres that is easier to use it in. So, for example, the mass vaccination centres, that's what it was designed for. And we're very much hoping that the AstraZeneca product is licensed at the end of December for rollout, because that's the sort of vaccine that we will need to get into care homes with and out into people's homes where they can't come in.
Thank you. Now we've got a question here which is very specific about Butlins in Minehead, who I think have announced today that they won't be opening their doors over the festive period. They've effectively said that they'll be closed for the rest of the year. I mean, that is quite an impact upon Minehead. I know there's people that were for and against Butlins being open in Minehead, and clearly has an impact upon a lot of people. But Trudy or Alison or something, I don't know if you'd like to comment on the fact, I think Trudy would, about Butlins making the announcement today.
Yes, so we did hear today that Butlins will be closing, and it was a decision entirely taken by the company themselves. So, I mean, I think it's obviously each individual business is responsible for making those kinds of decisions, and they've particularly said that it would be something that they would prefer to do. So I think we can only support them in that decision. We know it's something that people locally might find tricky if they're relying on the employment for that area, but equally the other side of the coin is that actually if there is people that potentially would have gone and would have mixed more as a result of going to Butlins, then actually there's two sides to every coin, isn't there? So I mean, I think in fairness to Butlins, it was a business decision that they took. So
yeah. Thank you, Trudy. And I'm going back to Alison Wootton again. We just knew that you were going to get lots of vaccination questions, and I like this one about how will the large centres work? Will there be like a drive-through McDonald's? And can family would you be treating a family in a car almost, having 4 vaccinators going to each car window and injecting what exactly is planned? Because I think our imagination runs away with us a bit with this one.
Okay, so for the centres that are running now, so for the GP practices that are running it, that is very much like a flu clinic. But and for anybody that had their flu jab this year, obviously with the COVID secure requirements, that socially distanced queues, making sure the flow is really good. The difference with the Pfizer vaccine that we're using now is that we do have to have an observation period. So we have to ask you to sit down for 15 minutes in a nice ventilated, very clean, because it will get cleaned every time you sit down, and the seats will all get cleaned before you sit on them, area for 15 minutes. But once you've had your 15 minutes monitoring, you're free to go. Where people are able, we encourage them to come on their own. So if you need a carer or somebody to help you, then of course that's fine, and we do have marshals and so on to support people who might need a bit of help, so we'd encourage people to come on their own. We won't be doing drive-through vaccines. It may be that one of the future ones does, but actually you do have to talk to people, understand their medical history, understand if they've got any contraindications to the drug, so are they on any medication that might affect it, have they had any reactions to drugs in the past. So by the time you've done all that in their administration, it's not something you can do at a car window.
No, and I presume the 15 minutes is because the allergic reaction that some people have had, and that's been brought in as a safety measure.
Absolutely, it's a safety measure. It did change at one stage. We didn't think we were going to have an observation period, but they've put it back in just to make sure. So I'm sure people sort of saw the news on the first couple of days of the vaccine going out that there were a couple of reactions around the country. And at the moment, so anybody that has had a significant reaction to drugs, food, or vaccines previously, the Pfizer vaccine may not be suitable for them, and they may be better waiting for the AstraZeneca vaccine, but that is something to discuss with your doctor. So they will take that history with you and just make sure that it is suitable for you before they give it to you.
Thank you very much. And we've only got a few minutes left, so if you do have any final questions, perhaps you could just post them. Any that's left over, we will of course be responding to them, making sure that you do get an answer. I see there's a very nice comment in there about the Clinton Rogers videos that we've been producing. That's I think the third one is out today. If you've not caught them, they are available on social media and I think on YouTube as well. So do please look out for Clinton, who's doing a great job, really really unpacking the subject and making sure that everybody just understands in a very simple way. He's just got a style about him which is just fantastic. Right, we are coming to here. So and Trish again from West Monkton. Thank you, Trish. That's very kind. Making some very supportive comments there about the newsletters which we publish regularly and each day as well. The updates. So thank you for that. So I'm not seeing anything more unless one of the moderator tells me to, in which case I'll begin to draw it to a close. Can I thank everybody that's actually joined us this evening? Here's a question. Would the panel recommend the vaccine for their mums? Yeah, absolutely. I'm looking around the panel. We can go all around the panel, but absolutely everybody's saying yes. And I think, Trudy, you're going to take this. Trudy. Very
yes.
briefly.
Absolutely, I would recommend it to my mum. And actually, I've already had a conversation with my mum who said she's more than happy to go on camera having hers. So we may well organise that at some point in time. So, but very happy to have it. My mum definitely.
Thank you, Trudy. Excellent. Right, I'm going to begin to draw to a close there. Can I thank all of you that have come along to listen to us? I hope you found it really useful. In particular, can I thank Trudy and Stuart and Alison Bell from the public health team? Can I thank Alison Wotton if I'm taking time out from, I'm sure, a really busy job, a career opportunity as she described it from the vaccination programme. Thank you also to Simon Clifford. We've had a host of people just behind the scenes making sure it all runs smoothly. So can I thank all of them for their work tonight? If you found it useful, we will try to do another one of these in the new year as things change. It's really important. But in the meantime, thank you for coming along tonight. Have a very safe Christmas, and do remember, hands, face, space, ventilate your rooms, and please don't drop your guard. The virus is still around and we just need to know that and remember it. Thank you. Have a good Christmas.